Hey, this is Dr. Glynn. For those of you who haven't seen the last video I posted about the pre-surgical bariatric psychological evaluation, introduction for myself, I'm a clinical psychologist. I work with patients who are having bariatric surgery, both pre-surgery and post-surgery, to help with some of the changes and the lifestyle changes that they're having to make to enable surgery to be successful. I also work with patients who are looking to lose weight who aren't bariatric patients, and when I do, all of the same principles apply. I get a lot of questions when I'm working with patients about how to handle various situations, how to handle various feelings, things like that. So I've decided to post some videos briefly addressing some of the topics, just to be able to give you some tips and ideas, put some information out there, just to begin to start to answer the questions. Obviously in the videos I won't be able to answer the questions fully, but I'll be able to give you a little bit of information to get started on that. Okay, so today I want to talk about this idea of being full. Okay, lots of patients, they talk to me when they're having the pre-surgical evaluations about the worry they are of like what it's going to be like to feel full, because they said they don't really know what it's like to feel full. Well, truthfully, if you get to the point where you're feeling full, okay, that really means you've already overeaten. Okay. One of the things that I encourage people to kind of to do is to get used to this idea that you're eating to be satisfied, not eating to be full. All right. So how do I achieve that? Okay, because a lot of people don't really even say to me they don't even know what feeling satisfied is like. So to feel satisfied, basically, it's you've eaten enough to satisfy the craving of the hunger. Okay, so you're no longer feeling hungry. All right. So one of the things you want to do to try and make this happen, especially in the early days, is why we encourage people to eat slowly. All right. And what does that look like? That really means if I'm eating a sandwich, I take a bite of the sandwich, I put the sandwich down. I don't hold the sandwich. I chew the sandwich until I've swallowed the sandwich. Then I pick the sandwich up and I have another bite of the sandwich, and then I put the sandwich down. Okay. Oftentimes we don't do that. We take a bite, and then before we've even fully finished chewing the first bite, we're already taking another bite, and so on and so on and so on. If you're eating a meal with you put the food on your fork, you put the food in your mouth, you then put the fork down, you chew the food. So you're looking to eat slower. That way you give everything a chance to get into the stomach, for your stomach to recognize what's in there, how much space is in there. It takes about 20 minutes for the signal to get from the stomach to the brain to say that you're full. All right. So by slowing down your eating, what you're doing is you're giving yourself the best possible chance of paying attention to that signal. All right. And then, like I say, you eat until you feel like the hunger craving has stopped, has finished. Okay. Now, that's going to vary from meal to meal depending on what you're eating, depending on the time of day, depending on various things. Okay, and it's not an immediate thing, so you'll have to play around with it a little bit. But that's the idea. The second thing around that kind of idea is that people, when they're trying to lose weight, they're concerned about, well, what if I'm hungry? Well, the truth is, if you are trying to lose weight or maintain what you would call a healthy weight, you're going to be hungry at least as much as you're going to feel satisfied. Okay, probably if not more. Most people who are walking around who are healthy weights, they're actually probably at least 50% of their day, maybe even more, feeling hungry. I know for myself. If I eat breakfast, probably about an hour and a half after I've eaten breakfast, I could probably eat again. All right. I don't, because I recognise that if I go on that kind of schedule, I'm going to be eating too much. But so what do? Is you learn to tolerate the hunger, and you learn to say to yourself, okay, so hunger is not necessarily a bad thing. Hunger is just something that I kind of have to tolerate, and I'm going to eat when I'm supposed to eat, not just because my body's telling me to eat. Okay. Now, obviously, if you're starting to get like headaches and stuff like that, and low blood sugar, you want to start maybe eating some fruit or things like that. But you don't want to just feed yourself just because you feel hungry. All right. You want to try and learn to tolerate the hunger. All right. The other thing that goes along with this, again, is it's all about nourishment. Okay. When you eat, you want to eat to be nourished, which means that when you're eating things that are have good nutritional value, not just eating things that have no nutritional value. All right, so you want to try as best you can to, the majority of the time when you're eating, eat things that have nutritional value as opposed to not. Okay, but basically the idea is, I just want to put out there, is that this idea of feeling full is not an idea that you really want to achieve, and also that hunger is okay, and we can all tolerate being hungry, and we all need to learn how to tolerate it differently. Okay, so that's just a little bit about feeling full and how to tolerate hunger. Like I say, one of the keys is to eat slowly. If you eat slowly, you give yourself the best chance to give your body the chance to send you that signal that you do feel satisfied, and therefore you're not going to run the risk of potentially overeating, because that sometimes happens too, where people they don't realize they've overeaten until several minutes after they've overeaten, which obviously is something we want to avoid. So hopefully this little bit was helpful. If you, as I say, if you haven't seen the video about the pre-surgical evaluations and you are planning on having a bariatric surgery, I suggest you have a look at it. Gives you an idea and insight on what to expect. If you found this video helpful and you want to be notified about new videos, subscribe. And my plan is to put videos out on a fairly regular basis addressing various topics. If there are any topics that any people particularly want, please feel free to leave some comments, and I will try my best to accommodate as many of those as I can. All right, again, this is Dr. Glynn, and this was just a video about this idea about feeling full and making sure that you try to eat appropriate amounts of food so that you don't overeat. Okay, all right. If you're losing weight, having bariatric surgery, wish you lots of luck, and hopefully you'll check out the next video. Thanks a lot.